Mr. Norcross? Gentlelady from Washington, Ms. Jayapal?
Thank you, Mr. Chairman and Secretary Becerra. It is so wonderful to see you here today and to say that shortly after your visit to Seattle, we were so proud to become the first city, major city in the country to reach a 70% vaccination rate. That's fully vaccinated. We're actually, I think, at 78% for first round of vaccinations. So we're proud to lead the country, Mr. Secretary, and it's because of the administration, because of the American Rescue Plan, and we thank you. You know, I think that we are still seeing so many of the catastrophic effects of the COVID-19 pandemic, and I wanted to ask you about three specific things. One is about the global pandemic. In the American Rescue Plan, $6 billion was allocated to Health and Human Services for COVID-19 vaccine development, manufacturing, distribution, and supply chains. Could you provide an account of how much of that money has been spent and how much is left that we can immediately put towards really improving our domestic production, investing $25 billion into production of vaccines that we can send to places around the world so we can combat this pandemic globally?
Congresswoman, first, congratulations on the work that your city has done. It is phenomenal, and it was a great visit that we had, and I could see why you got to 70% so quickly, because I could see how well everyone was working together as a team. On the question of the dollars, and if I get these wrong, my team will make sure that we correct them. And so let me just break down the $6 billion. $2 billion of the funding has been going to operations. Another $3 billion is being used for antivirals. Thanks as well to the American Rescue Plan, the president is working on the $10 billion that were approved for domestic manufacture capabilities for PPE and pharmaceuticals. And we're going to be investing in this budget that we presented, 21.5 million or so in new funding for the Resilient Supply Chain and Shortages Program. So we're doing what we can to prepare. We're doing what we can to make sure that we recoup what we had to use, and we're going to try to be ready for anything coming at us in the future.
Thank you, Mr. Secretary. So you're saying there's nothing left of the 16 billion. Is that correct?
Well, I don't know if there's any. A lot of it's been earmarked. We probably still have some there, and we could try to give you the precise numbers when we follow up with your team, if you'd like.
Great. Well, you know, I think we're trying to work very hard to make sure that we invest 25 billion into addressing and getting vaccines to countries around the world, because as you know, low-income countries have received just 0.4% of vaccines. And we're not going to defeat this crisis unless we defeat it globally. In addition to the need for greater global vaccine access, COVID-19 has shown us why ensuring healthcare for all is critical. Right now, there are critical improvements to Medicare that President Biden has committed to. Can you speak to the importance of lowering the Medicare eligibility age to 60 so that we include 23 million additional Americans, including nearly 2 million uninsured individuals, and improving Medicare benefits to include dental, vision, and hearing? And will you work with us, Mr. Secretary, to make that a reality for Americans?
Yeah, and before I give the answer to that, can I just add that the 580 million vaccines that President Biden has committed to the world, to the COVAX program, but globally to make sure they're out there, those surplus vaccines that we can make available will help tremendously in our commitment to be a partner in trying to help the world get vaccinated. And that's part of our ongoing work. And we've been able to do that because we've been able to get so far along, as you've mentioned with your city, in vaccinating Americans. So those surplus vaccines will be made available to the world. In regards to the benefits of lowering the age of eligibility for Medicare or expanding services like hearing, vision, dental to seniors and Medicare, let me tell you, it's due. We need to move forward. The president is supportive. He'd like to support anything that you all do in Congress. There's a number of ways to get there, but what we're hoping to do is to continue the work that has increased the number of Americans who have affordable care, whether it's through the ACA, whether it's through Medicare. We want to see more Americans get covered till every American has that right to say, I have access to health care.
Fantastic. And I have just a few seconds left, but I do want to give you a chance to address the consequences of Donald Trump's zero humanity policy to separate children from their parents, which has a conspicuous silence from many of my Republican colleagues. 3,900 children were separated by this policy, and we cannot yet reconfirm reunification for 2,100 families. Secretary Becerra, just tell us how your administration has been tackling this terrible problem created by the former administration.
Congressman, and I know the time has expired, so I'll be very brief and simply say, I have 3 daughters. Don't let anyone try to separate me from my daughters. I think every parent thinks the same way. We must think of that not just with our own personal children, but with all the children that we have in this country. And we're going to do everything we can, at least under this administration, to keep families together, not to break them apart.
Thank you, Secretary. I wish we could hear more from you because you've done so much, but I'm respecting that my time has expired, Mr. Chairman. Thank you.
Thank you. The gentleman from Indiana, Mr. Banks.
Thank you, Mr. Chairman. Mr. Secretary, I'm deeply concerned.
I can't hear.
Can you hear me now?